Medicine and the organizing committee for inviting me to come over and present this. It's like a more sharing session of what we do in Malaysia. So I'm a clinical specialist and academician in special needs dentistry. We call it special needs rather than special care dentistry in Malaysia. There are 13 dental schools in Malaysia and only 3 dental schools with academicians in specialist dentistry. So I also teach special needs dentistry in some of the dental schools across Malaysia, in addition to my own. So, but today I'm going to present the work that I do in relation to interprofessional oral health education in my university. So I'd like to begin my presentation by quoting a statement by the WHO, which highlighted that oral health is integral to general health and is essential to well-being. Many studies have shown a link between oral health and systemic health, and also quality of life. Various disorders affecting the different body functions and systems may manifest in the oral cavity, presenting with oral signs and symptoms. In addition to that, poor oral health is also related to causation of systemic disorders and deterioration of systemic illness. And so the strong association between oral health, systemic health, and quality of life justify the importance of interprofessional collaboration between dental and non-dental healthcare team in an effort to promote comprehensive approach to patient care. However, it has been perceived by patients and their caregivers that non-dental healthcare practitioners had inadequate skills, poor attitudes, lack of empathy, and low motivation and support for oral health care. Non-dental healthcare professionals and students also demonstrated poor oral health knowledge and attitudes, as well as a lack of understanding of the relation between oral and systemic health. So for my PhD studies, I was looking at how we can enhance the education of dental and non-dental healthcare team in an effort to promote interprofessionalism in oral health management of patients with special healthcare needs. First of all, what is interprofessional education? It is when 2 or more professionals learn from, with, and about each other to improve collaboration and the quality of care. Why do we want to involve the non-dental healthcare team? Because it has been found that patients with special healthcare needs demonstrate better utilization of medical and allied health services compared to dental. Even for oral and dental complaints, patients with special healthcare needs and even the general population tend to seek medical advice rather than going to see a dentist. And we know that medical and nursing staff make up a big proportion of the healthcare team, and they have direct access to a patient's healthcare plan. So if we can empower these practitioners and get them to incorporate some oral health messages in their daily healthcare plan, a wider extent of our patient population can be accessed and benefit from their intervention. And from my study, I found that medical and nursing students express discomfort in performing various oral health activities, such as performing basic oral examination, detecting oral cancer, deciding for dental referral, and performing emergency oral or dental care. On top of that, oral health education in Malaysian medical and nursing schools also lacked well-defined learning objectives, structured clinical training, and standardized assessment approach, which may lead to compromise quality of teaching, learning, and practice. Such inadequacy may be related to the lack of collaboration between the medical and dental and also the allied health faculties in terms of sharing of information and also exchange of knowledge and skills between these 2 faculties, as what was opined by one of my study subjects. Because we have always been working in silo, that's what's been happening, at least in my own country. So for future directions, I tend to explore opportunities for interfaculty collaboration to provide adequate training for the future healthcare practitioners in interprofessional oral health care. So what I did as soon as I came back from my PhD is I established an interprofessional oral health education research interest group to initiate effort, give adequate training to the students, and my team composed of those from the medical, allied health, and nursing team. So we have practitioners, experts, and clinicians in all these fields in order to develop a training program or activities to promote interprofessionalism in oral healthcare, especially for patients with special healthcare needs. So one of our first activities was to organize a conference, the Disability Weekend Conference, and our team was empowering multidisciplinary care for people with special needs. And we have gathered all the experts, the clinicians and practitioners from various fields, from the medical and allied health and also dental specialties. And also we involve special education teachers, disability advocates, parents of children with special needs to share their opinion, views and experience in managing patients with autism, physical disability, hearing, speech, and visual disability, as well as those with intellectual disability. So it was a huge success. About more than 400 people came over to participate in our activities, which is one of the first of its kind in my country. So other activities during the conference involved performance by individuals with special needs. This is to create awareness amongst the public about the abilities, the talents that that people with disabilities can do, rather than focusing on their disabilities. Other activities include the opening ceremony of our special care clinic. We organized free dental checkup and also table clinic competition. So the other activities is community engagement projects, where we won a competitive grant from Petronas, which is our national petroleum company, to develop the mobile dental service for people with special needs. But I'm going to highlight the activities that we organized together with students and practitioners from other faculties. So All Kids project is a project where we visit centers for Down syndrome children and adults, and we invited people from various backgrounds, such as dietitian and also the medical students and medical nurses, to give talks to the parents and also the caregivers and teachers in that center. And here we have medical students trying to helping dental students and dental specialists doing dental examination and treatment on patients with Down syndrome. We also involve student volunteers from the medical, speech therapy, occupational therapy faculties, as well as dental specialists from various backgrounds to participate in oral hygiene instruction, demonstration, and organizing fun and games, and also doing basic health examination. So what we did before the project is that we had a training session where the dental team will teach the non-dental team to perform basic oral examination, to do oral hygiene instruction, to do dental charting, and also dental assistance. And at the same time, the non-dental healthcare practitioners or students teach our students on how to do their stuff, such as how to do basic general examination, hygiene care, patient lifting, and also just giving us a consult. For example, we wanted to do activities on visual impairment students, so the oral health, the occupational health students provide us with advice and suggestions on how we can actually conduct the activities in a more effective manner. So Let's Play Carnival is a sports activity involving children and adults with physical and intellectual disabilities. So our student volunteers were those from dental, medical, and occupational therapy faculties. Hold My Hand project, where we went to a special education school for for children with visual impairments, and our student volunteers are from dental faculty, occupational therapy, and also we involve the counselor and psychologists as well. So here, this is a clinical psychologist conducting a neuro-linguistic programming session with children with visual impairments. So we had our students to help as a facilitator and assistants in the program. Our dental students are treating a school child with visual impairments, and we had oral health occupational therapy students helping with dental assistance. And they also help us to organize fun activities for these children. Okay? And our work was published published in our local newspaper. So the other one is our Helping Souls program, where we invited families with children with and without special needs. So we want to help the family and also family members who do not have special needs, and how they can actually help their family members with special needs to empower oral health care and also general health. So we had medical officers and students coming as well, optometrists and nurses. Yeah. So here we had an optometrist doing this visual examination. So we had our dental students as well helping out, and they also teach us about how to communicate with patients with visual impairments, and we share information about each other's field of practice. So Beyond Border Community Service Project is a community service project in Borneo, in a rural community. And the thing about people living in the rural area in Borneo is that they have very limited access to professional healthcare. Some of them had to travel about 8-9 hours to the nearest dental clinic. And they also practice unhealthy, high-risk behaviors such as smoking, drinking, betel nut chewing. So the prevalence of oral cancer in rural areas in Borneo are very high. So what we aim to do is to empower the medical assistants who are assigned in the small clinics in these rural activities to perform basic oral examination and to identify suspicious oral lesion which requires urgent and prompt referral. So our work was being published as well in the local newspaper. So other activities such as giving some case studies, case report presentation in front of my medical, nursing and health sciences colleagues. I was also invited to give lecture to nursing schools, special education school, and living institutions for people with disabilities, as well as interfaculty collaboration in innovation projects. Like I developed an app to facilitate communication between dentists and patients with hearing and speech impairments. I collaborated with the computer science students. So this is just me trying to promote oral health for people with special needs. And this is us.